Hello, today I'm going to talk to you in this quick video around possible causes behind pain felt at the front of your knee, which we currently call patellofemoral pain. This has been called many things in the past, including patellofemoral pain syndrome, anterior knee pain and runner's knee. So we tend to see this presenting itself as pain felt behind the kneecap, especially through positions where the knee is in a flex position and also under load. So this is things like going up and down stairs, squatting, running and jumping. This is a condition we tend to see more in women, and this is largely due to the wider pelvis, which creates this larger sideways pulling force into the joint at the kneecap, the patellofemoral joint. As you can see demonstrated in this photo, comparing male and female models. So before going through some of the anatomy, it is important to remember that this isn't just seen in people with arthritis, and often the pain is felt due to things becoming irritated, so we need to be clear that even though things hurt, we are not necessarily causing any damage. Thinking about the anatomy, the kneecap in a healthy knee glides in a pretty straight line. But importantly, it spreads the force equally on the cartilage underneath. Going into the muscles, there are a few things we want to consider. But focusing on the big muscles at the front of the thigh, these all insert into the common tendon here, which as you can see straps over the kneecap, and this keeps it moving on its preferred track. When we think about what we want from these, we want a nice balance of forces, shown in this diagram. As you can see, or as you can imagine, if there was a larger force pulling in one direction, it could affect the way the kneecap moves on its surface. So there are multiple hypotheses as to what the actual root cause for this condition is. The first one is this idea of maltracking, which means the kneecap is not quite spreading that force equally. When the pressure isn't spread equally, it can cause more force to be placed on one side. We know that the cartilage itself cannot generate any pain, telling us that it's more likely to come from structures in the area becoming a bit unhappy. This is important to know as it highlights that there is not necessarily damage to the cartilage. Another theory gets us thinking about this idea of homeostasis, and this essentially just means balance. So now looking at this diagram, we have this big section in the middle where the tissues are working within their range, where we won't lose strength nor will we gain it. However, if you look above this line, this is where if you put a bit too much force through the tissues, they become to get unhappy, sore, swollen and irritated, and we start to feel pain. So this can be done in a single loading event where you've sort of gone too much too soon, or it can be upset gradually. As an example, if a runner upped running mileage by 30% in 2 weeks, they'll be pushing the tissues a bit too quickly when we think about the load that they're used to, and this could lead to them developing this patellofemoral pain. So things you might notice are that your knees might drop into this knock knee position when performing something like a squat or even running, perhaps when you start to feel tired. This kind of thing may tell us that there is potential muscle weakness, or that the muscles aren't quite doing their job properly or working together around the hip or the thigh. The issue may also be coming from the foot and ankle positioning, so this can be things like rolling your foot inwards, but your physio will look into this. An important thing to remember is that stopping exercise is absolutely not the answer. The best approach is to stop what is causing the pain and add strengthening to the hip and thigh muscles so you can get back to doing what you enjoy. If you are suffering from this kind of anterior knee pain, getting a thorough assessment will allow you to understand how different factors might be contributing to your knee pain, and allow us to work together to decide on a treatment plan to allow you to get back to doing the things that you love. Thank you for listening and take care.